Hello, everyone, and welcome back to our Nano and Honey podcast.
Hello, everyone. It's so good to have you with us today.
We're excited to bring you another useful and interesting episode, especially for everyone who's preparing for OET medicine or wants to improve their medical English.
That's right. Today, we're going to talk about a very important and very common medical condition, type 2 diabetes.
It's a topic that healthcare professionals come across very often, and it's a topic that gives us a lot of useful medical vocabulary and communication practice.
So, whether you're a doctor, a nurse, a medical student, or an OET candidate, this episode is for you.
And today's podcast is going to be a little different from a simple medical lesson.
Yes, we're going to have a natural conversation, discuss a realistic medical situation, learn important vocabulary, and then give you some OET-style listening and speaking practice.
So don't just listen passively.
Get comfortable, keep a notebook nearby, and get ready to participate.
Because during the episode, we'll sometimes ask you questions and give you a few seconds to think about your answer.
And later, you'll even have a chance to practice speaking as if you were the healthcare professional.
Sounds good.
It does.
So, Nano, let's start with the basics. What exactly is type 2 diabetes?
Type 2 diabetes is a chronic condition that affects the way the body uses glucose, or blood sugar.
And glucose is something our body needs for energy, right?
Exactly. Glucose is an important source of energy for the body's cells.
So, what goes wrong in type 2 diabetes?
In type 2 diabetes, the body becomes resistant to insulin, or it might not produce enough insulin to maintain a normal blood glucose level.
And the term for that is insulin resistance.
Exactly.
Insulin resistance means that the body's cells do not respond properly to insulin.
That is an important medical term to remember.
Insulin resistance.
Yes, and when the body cannot control blood glucose effectively, the level of blood glucose can become too high.
Which brings us to another useful term, hyperglycemia.
Correct. Hyperglycemia simply means a higher than normal level of glucose in the blood.
So already we have three important terms, glucose, insulin, and insulin resistance.
And we're just getting started.
Exactly.
Now, one thing that makes type 2 diabetes interesting is that a person may have it for quite some time without noticing clear symptoms.
That's true. The condition can develop gradually.
Yes, some people may feel completely well, while others may experience symptoms such as increased thirst, frequent urination, tiredness, blurred vision, or unexplained weight changes.
So, the absence of symptoms doesn't necessarily mean that everything is normal.
Exactly.
And that's an important point for healthcare professionals to communicate to patients.
Definitely.
So, what are some of the main risk factors for type 2 diabetes?
There are several. These can include being overweight or obese, having low levels of physical activity, having a family history of diabetes, and getting older.
Lifestyle can also play an important role.
Yes, eating habits, physical activity, sleep, and other lifestyle factors can all influence a person's risk.
But we should be careful not to make patients feel blamed for their condition.
Absolutely. That's where patient-centered communication becomes very important.
We'll definitely come back to that later.
We will. But first, let's talk about how type 2 diabetes is diagnosed.
Good idea. How do healthcare professionals usually confirm the diagnosis?
Blood tests are used to assess blood glucose levels. One important test is HbA1c.
HbA1c is a very common term in medicine.
It is. HbA1c gives an indication of a person's average blood glucose level over approximately the previous 2 to 3 months.
So, it gives healthcare professionals an idea of long-term blood glucose control.
Exactly.
And that means OET candidates should be comfortable hearing and using the term HbA1c.
Definitely.
Now, before we move on, let's give our listeners a quick challenge.
Yes, This is your first listening check.
Listen carefully to this question.
Why might type 2 diabetes remain undiagnosed for a long period of time?
Take a few seconds and think about it. Okay, the answer is that some people may have few or no obvious symptoms, even when their blood glucose levels are elevated.
Well done if you got that right.
And notice something important here. The question did not use exactly the same words as our conversation.
That's very important for OET listening practice.
You need to listen for the meaning, not simply wait for an identical word or phrase.
And that skill is going to be one of the main focuses of today's episode,
So stay with us.
because there's much more to come.
Now that we understand what type 2 diabetes is, let's take a closer look at how healthcare professionals actually manage this condition in everyday clinical practice.
Yes, because hearing the definition is one thing, but understanding how to discuss diabetes with a patient is something completely different.
Exactly. Imagine a patient has just received their test results and the healthcare professional needs to explain what they mean.
That could be quite an emotional moment for the patient.
It can be. Some patients may feel shocked, worried, or even guilty.
And that is why the first conversation needs to be handled carefully.
A healthcare professional might begin by saying, "Your blood test results suggest that you have type 2 diabetes. I'd like to explain what that means and talk about the next steps with you."
I like that approach because it gives the patient information without overwhelming them.
Yes, it also opens the door for a conversation rather than turning the consultation into a one-way lecture.
What could the healthcare professional say next?
They might say, "Type 2 diabetes means that your body is not using insulin as effectively as it should, which has caused your blood glucose levels to rise."
And then they could check whether the patient understands.
Exactly. They could ask, "Does that make sense so far?" Or, "Would you like me to explain that in a little more detail?"
Those are simple sentences, but they are very useful in clinical communication.
They show that the healthcare professional is not just delivering information, they are checking the patient's understanding.
That's an important OET skill too, isn't it?
Very important. In a speaking task, effective communication matters just as much as your medical knowledge.
So candidates should practice phrases that help them explain, clarify, reassure, and check understanding.
Exactly. Let's give our listeners some examples. Here are a few useful expressions. Let me explain that in simple terms.
What this means is,
Just to make sure I've explained that clearly, could you tell me what you understand so far?
and another useful phrase is, what concerns you most about the diagnosis?
That last question is especially valuable because it allows the patient to express what they are actually worried about.
And patients can have very different concerns.
Absolutely. One patient may be worried about medication.
Another may be concerned about changing their diet.
Someone else may be frightened because a family member has serious complications from diabetes.
Or a patient may simply be overwhelmed because they don't know what happens next.
That's why healthcare professionals should avoid making assumptions,
Instead, they should ask open questions.
such as,
How are you feeling about the diagnosis?
"What questions do you have at the moment?"
What changes do you think would be easiest for you to make?
And, "Is there anything you're particularly concerned about?"
These questions encourage the patient to speak.
Exactly. And listening is a major part of good communication.
Let's talk about treatment now,
Treatment for type 2 diabetes is usually individualized.
meaning that the same plan may not be suitable for every patient.
Correct. Treatment depends on factors such as the patient's overall health, blood glucose levels, other medical conditions, current medications, lifestyle, and personal circumstances.
So there isn't one single treatment plan for everyone.
Exactly.
Interesting. Lifestyle changes are often discussed early on, right?
Yes. Depending on the patient, this may include increasing physical activity, making healthier food choices, losing weight where appropriate, and reducing behaviors that may increase health risks.
But telling someone just lose weight and exercise more isn't necessarily good communication.
Correct.
Why not?
Because it may sound judgmental or unrealistic.
And every patient has different circumstances.
Exactly. Someone may work long hours, care for family members, have mobility problems, have financial difficulties, or simply feel uncomfortable exercising in a gym.
So instead of giving general instructions, the healthcare professional should explore what is realistic for that individual.
Yes, for example, they could ask, "What does a typical day look like for you?"
That's a very useful question.
It allows the healthcare professional to understand the patient's routine before suggesting changes.
Then they can work together to create achievable goals.
Exactly. We call these realistic or achievable goals.
That's another phrase our listeners should remember.
Realistic goals.
And achievable goals.
Instead of asking a patient to completely change their lifestyle overnight, the healthcare professional might suggest starting with 1 or 2 manageable changes.
Such as walking for 20 minutes several times a week.
Yes, depending on the patient's health and what their healthcare team recommends.
Or replacing sugary drinks with water.
Exactly. Small changes can become part of a long-term routine.
And what about medication?
Some people with type 2 diabetes will need medication to help control their blood glucose.
Is medication always started immediately?
Not necessarily. The treatment approach depends on the individual clinical situation.
And treatment may change over time.
Yes, a patient may need adjustments depending on how well their blood glucose is controlled and whether they experience side effects or other health issues.
So monitoring becomes very important.
Exactly.
The healthcare team may monitor blood glucose, HbA1c, blood pressure, cholesterol, kidney function, and other aspects of the patient's health.
Because diabetes affects more than just blood sugar.
Correct. It is closely linked with cardiovascular health, kidney health, eye health, nerve function, and foot care.
That brings us to complications.
Yes, poorly controlled diabetes over a long period can increase the risk of serious complications.
But again, we need to communicate this carefully.
Because we don't want to frighten the patient?
Exactly. We want to inform the patient and help them understand that good management can lower the risk.
So instead of saying, if you don't control your diabetes, you could lose your sight, a healthcare professional could say something like, keeping your blood glucose, blood pressure, and cholesterol under control can help reduce the risk of complications, including problems with your eyes.
Much better.
And that is a great example of positive, patient-centered communication.
Now, let's imagine the patient says, "I'm scared because my mother had diabetes and developed kidney problems."
The healthcare professional should first acknowledge the concern.
They could say, "I understand why that would worry you, especially given your family history."
Then they could provide reassurance without making unrealistic promises.
For example, having diabetes does not mean that you will automatically develop the same complications. There are several things we can do to reduce your risk.
That is a very useful communication pattern.
First, acknowledge the emotion.
Second, provide accurate information.
And third, give the patient a practical next step.
Exactly.
That is the kind of structure that can make a conversation sound natural and patient-centered.
This is the kind of structure that can make your communication sound professional and empathetic.
Let's practice it together.
Good idea.
Imagine the patient says, "I'm really worried that I'm going to have diabetes for the rest of my life."
Take a few seconds.
Think about how you would respond if you were the healthcare professional.
Here is one possible response.
I understand that this diagnosis may feel overwhelming. Type 2 diabetes is a long-term condition, but there are many ways we can manage it effectively. We can work together to find a treatment and lifestyle plan that suits you.
Notice the language. I understand. We can work together. And a plan that suits you.
These expressions show empathy and collaboration.
They also avoid sounding overly directive.
And that is exactly the kind of language that can make your communication sound more natural and patient-centered.
Now let's move into another important area, medication adherence.
Yes, this is a useful topic for both medical English and OAT practice.
Medication adherence refers to how consistently a patient takes their medication as prescribed.
And why might a patient struggle with adherence?
There can be many reasons. They may forget doses, experience side effects, have concerns about the medication, misunderstand the instructions, or simply find it difficult to fit the treatment into their daily routine.
Financial difficulties can sometimes be a factor too, depending on the healthcare system and the patient's circumstances.
Exactly.
Exactly. So, if a patient is not taking their medication as prescribed, the healthcare professional should avoid immediately judging them as a non-compliant.
Yes, instead, they should find out why.
What could they ask?
Could you tell me how you've been taking your medication?
Have you experienced any problems or side effects?
Is there anything that makes it difficult for you to take your medication regularly?
Those questions can reveal the real barrier.
And once the barrier is understood, the healthcare professional can work with the patient to find a solution.
Exactly.
This idea of exploring barriers rather than blaming the patient is extremely important in patient-centered care.
And it gives us another useful expression for today.
Which is?
Barriers to treatment.
Barriers to treatment are factors that make it difficult for a patient to follow or access a recommended treatment plan.
Excellent.
So listeners, add that phrase to your vocabulary list.
Barriers to treatment.
And now, before we continue, let's see how much you remember.
Here comes another quick listening challenge.
What should a healthcare professional do when a patient is struggling to take their medication regularly?
Think about the best answer.
The key point is that the healthcare professional should explore the reason behind the difficulty rather than simply criticizing the patient.
Exactly. Understanding the barrier is often the first step towards finding a solution.
And that is an important lesson not only for type 2 diabetes, but for many chronic conditions.
Absolutely. Good healthcare communication is not just about giving instructions.
It is about understanding the person behind the condition.
And that is where we'll continue in the next part of our conversation.
Now let's look at one of the biggest challenges in managing type 2 diabetes, helping patients make realistic changes to their everyday lifestyle.
Yes, because when people hear the words lifestyle changes, they sometimes think they have to completely change their life overnight.
And that can feel overwhelming.
Exactly. A healthcare professional's job is not simply to give a long list of instructions.
The goal is to help the patient understand which changes are important and then identify changes that are realistic for them.
So, where would you begin with a patient who has recently been diagnosed?
I would begin by finding out what the patient already knows.
Why is that important?
Because patients come into consultations with different levels of knowledge, and they may already have information from family members, social media, or the internet.
And not all of that information is necessarily accurate.
Exactly. So a healthcare professional might ask, what have you heard about type 2 diabetes? Or what do you already know about managing your condition?
That gives the patient an opportunity to explain their understanding.
And it also helps the healthcare professional identify misunderstandings.
For example?
A patient might believe that they can never eat carbohydrates again.
That's quite a common misunderstanding.
It can be. Another patient might think that if they start medication, they no longer need to pay attention to their diet or physical activity.
Which is why education is such an important part of diabetes management.
Exactly.
And when we say patient education, we mean helping patients understand their condition, their treatment, and how they can manage their health.
It also means giving information in a way that matches the patient's level of understanding.
That's another important OET skill.
Absolutely. You need to show that you can explain medical information clearly and appropriately.
So let's talk about diet.
Good idea.
When discussing diet with a patient who has type 2 diabetes, what should a healthcare professional focus on?
A balanced eating pattern is important. Patients can be encouraged to choose a variety of nutritious foods and manage portion sizes.
So it's not simply about banning one particular food.
Correct. The advice should be practical and individualized.
What about sugary drinks?
Reducing sugary drinks can be a useful change for many patients because these drinks can contain a significant amount of added sugar.
And a simple substitution might be choosing water or another suitable lower sugar option.
Exactly.
So what about sweets and desserts?
Again, the discussion should be balanced. Rather than creating a list of foods that a patient is never allowed to eat, the healthcare professional can help the patient understand portion sizes, frequency, and overall dietary patterns.
That sounds much more realistic.
It usually is.
And how would you explain this to a patient who says, "So I can never enjoy my favorite food again"?
I might say you don't necessarily need to avoid your favorite foods completely. We can look at how often you eat them, the portion size, and how they fit into your overall eating pattern.
That sounds supportive rather than restrictive.
Exactly.
And that's an important distinction.
Yes, effective counseling should encourage long-term changes rather than unrealistic short-term restrictions.
Let's move on to physical activity.
Physical activity is another important component of diabetes management.
And once again, the advice needs to be individualized.
Absolutely.
So a young, healthy patient may have very different options compared with an older patient with mobility difficulties.
Exactly. We should consider the patient's abilities, preferences, medical conditions, and current activity level.
So instead of saying you need to exercise more, you could ask, what types of activity do you enjoy? Or what kind of exercise feels manageable for you?
Yes.
That makes the conversation more collaborative.
And collaboration can make patients more likely to engage with the plan.
Here's a question. What happens if the patient says, I hate exercise?
I wouldn't argue with them.
Fair enough.
I might ask, what kinds of physical activities do you enjoy, if any?
And perhaps the patient likes gardening, walking with a friend, swimming, or cycling.
Exactly. Physical activity doesn't always have to mean going to a gym.
That's a useful message for patients.
It can also make the advice feel more achievable.
Now, let's talk about weight management.
Weight can be a sensitive subject, so communication is particularly important.
Yes, the healthcare professional needs to avoid making the patient feel judged or embarrassed.
Exactly. Language matters.
Can you tell me what you'd say to a patient who is overweight and has type 2 diabetes?
I might say we know that weight can affect blood glucose control, and even a modest amount of weight loss may be beneficial for some people. Would you be comfortable talking about your current weight and whether you'd like support with weight management?
That's much more respectful.
It gives the patient a choice and invites discussion.
And it avoids making assumptions.
Exactly.
And another important topic is smoking.
Yes, smoking can increase cardiovascular risk, which is especially relevant for people with diabetes.
So a healthcare professional may discuss smoking cessation as part of the patient's overall care plan.
Correct.
And again, the communication should be supportive rather than judgmental.
Absolutely. Instead of saying you must stop smoking, the healthcare professional might ask, would you be interested in discussing support to help you stop smoking?
That gives the patient an opportunity to engage with the conversation.
And it demonstrates shared decision-making.
Shared decision-making is another useful phrase.
It means that the healthcare professional and the patient work together when making decisions about the patient's care.
Very useful for OET.
Definitely.
Now, let's imagine our patient has received a lot of information during the consultation.
What should happen before the consultation ends?
The healthcare professional should check the patient's understanding.
And perhaps summarize the main points.
Exactly. For example, before we finish, let's quickly go over what we've discussed today.
Then, the healthcare professional could say, you're going to start by reducing sugary drinks, increasing physical activity gradually, and taking your medication as prescribed.
And then they could ask the patient to repeat the plan in their own words.
Yes, this is often called the teach-back method.
Can you explain that?
The teach-back method is a way of checking understanding by asking the patient to explain the information back in their own words.
For example, just so I know I've explained everything clearly, could you tell me how you're going to take your medication?
Exactly.
That's an excellent clinical communication technique.
And it's much better than simply asking, do you understand?
Why?
Because patients may say yes even when they are unsure or confused.
But asking them to explain the information gives the healthcare professional a clearer idea of what they actually understood.
Exactly.
Now let's test your listening again.
Here is your question.
Why is it useful to ask a patient what they already know about type 2 diabetes?
Take a few seconds to think.
The key reason is that it helps the healthcare professional identify the patient's existing knowledge and any misunderstandings.
Well done.
And now a vocabulary question.
What does shared decision-making mean?
Think about it.
It means the healthcare professional and the patient work together when making decisions about the patient's care.
Excellent.
Now, let's look at a few phrases that you can actually use in a clinical conversation.
Let's do it.
Phrase number 1 is, would you be comfortable discussing?
This is a polite way to introduce a sensitive subject.
For example, would you be comfortable discussing your diet?
Or would you be comfortable discussing your smoking habits?
Phrase number 2 is, what do you think would be manageable for you?
This is useful when discussing lifestyle changes.
Phrase number 3 is, let's work out a plan that suits you.
That's a great phrase because it shows collaboration.
Phrase number 4 is, can I just check that I've explained that clearly?
And phrase number 5, could you tell me what you understand from what we've discussed?
These expressions are simple, natural, and highly useful in healthcare communication.
And the more you practice them, the more naturally they'll come to you.
Exactly.
Now we're going to take everything we've discussed and put it into a realistic patient conversation.
This time, listen carefully to both the medical information and the communication techniques.
We're going to focus on a patient who has recently been diagnosed with type 2 diabetes and worried about making lifestyle changes.
Listen closely because after the conversation, we'll ask you to identify some important details.
Let's begin.
Imagine you're sitting in a real medical consultation. A patient has recently received a diagnosis of type 2 diabetes, and today they have returned to discuss the results and what happens next.
The patient is feeling worried because they have never had diabetes before and are not sure how much their life will need to change.
Good morning, Mr. Harris. Please come in and have a seat.
Thank you, doctor.
How have you been feeling since we last spoke?
To be honest, I've been quite worried.
I'm sorry to hear that. Would you like to tell me a little more about what's been concerning you?
Well, when you told me that my blood tests showed diabetes, I started thinking about my mother. She had diabetes too, and she developed kidney problems later in life.
I can understand why that would make you anxious, especially given your family history.
Does that mean I'm going to have the same problems?
Not necessarily. Having type 2 diabetes does not mean that you will automatically develop the same complications as your mother.
So there's a chance I can avoid them?
Absolutely. There are several things we can do to reduce your risk, and good diabetes management can make a significant difference.
What would I need to do?
There are several parts to managing diabetes. We'll look at your blood glucose control, your medication, your diet, physical activity, blood pressure, cholesterol, and your general health.
That sounds like a lot.
It may sound like a lot at first, but we don't expect you to change everything immediately.
That's good to hear.
We can take it step by step and set a few realistic goals together.
What kind of goals?
Before we decide that, I'd like to understand your current routine. Could you tell me what a typical day looks like for you?
Well, I work in an office, so I spend most of the day sitting.
How many hours would you say you're sitting during the working day?
Probably 8 or 9 hours, sometimes more.
And what about physical activity?
I don't really exercise.
Have you ever enjoyed any kind of physical activity?
I used to walk in the evenings, but I stopped a few years ago.
What made you stop?
I became busy with work, and then I got out of the habit.
That's understandable. Would you consider starting with short evening walks again?
Maybe. I suppose I could.
That could be a good starting point. We don't need to make it complicated.
How often should I walk?
We can discuss a suitable plan based on your overall health and what's realistic for you. The important thing is to build up gradually and choose an activity you can maintain.
I think I could manage that.
Good. Now let's talk about your diet.
That's probably where I have the biggest problem.
Tell me a little about your usual meals.
I often skip breakfast, then I have a large lunch, and in the evening I usually eat quite a lot because I'm hungry.
Curious, what do you usually drink during the day?
Quite a lot of soft drinks.
How many would you say?
Maybe 2 or 3 cans a day.
Would you be comfortable discussing some alternatives?
Yes.
One simple change could be to reduce sugary drinks and replace some of them with water or another suitable lower sugar option.
I think I could do that.
Good. And rather than trying to change your whole diet at once, we can focus on a couple of manageable changes.
That sounds much easier.
Exactly. Small, sustainable changes are often easier to maintain than dramatic changes that only last for a few weeks.
What about sweets? Do I have to stop eating them completely?
Not necessarily. It's more helpful to think about your overall eating pattern.
portion sizes, and how often you have foods that are high in added sugar.
So I don't have to give up everything I enjoy?
No, the aim is to find a balanced approach that works for you.
Smiles. That makes me feel much better.
Professional, I'm glad. Now let's talk about the medication we discussed at your last appointment.
I'm actually quite worried about taking it.
Gentle, what concerns you most?
Hesitant. I'm afraid I'll have to take it forever.
Reassuring, I understand that concern. It's important to know that treatment can change over time depending on how your condition responds and how your overall health develops.
Curious. So the medication might be changed later?
Yes, we'll monitor your progress and review your treatment regularly.
Concerned. What if I get side effects?
Calm. If you notice any problems or side effects, let us know rather than stopping the medication on your own.
Okay.
Calm. We can then discuss what you're experiencing and decide whether any changes are needed.
Thoughtful. That makes sense.
Encouraging. Good. I also want to make sure you feel comfortable asking questions whenever something is unclear.
Warm. Thank you.
Clear. Before we finish today, let me summarize the main points.
Attentive. Okay.
Calm. You'll start by reducing sugary drinks, gradually becoming more physically active, and taking your medication as prescribed.
Right.
Clear. We'll also arrange follow-up monitoring so that we can review your blood glucose control and see how you're doing.
Thoughtful. So I don't need to solve everything immediately.
Exactly. We'll take it one step at a time.
Relieved. That actually makes me feel much more confident.
Encouraging. That's what we want. Managing a chronic condition is a long-term process, and you don't have to do it alone.
Warm. Thank you, doctor. I appreciate that.
Friendly. You're very welcome. Before you go, what questions do you have?
Thoughtful. I think my biggest question is whether I'll still be able to live a normal life.
Reassuring. Yes, many people with type 2 diabetes lead active and fulfilling lives. The key is understanding your condition, following your treatment plan, attending regular reviews, and making healthy choices that are realistic for you.
Hopeful. That's reassuring.
Good. We'll work on the next steps.
Friendly. Thank you, doctor.
Warm. You're very welcome. Take care, and we'll see you at your follow-up appointment.
And that was a great example of patient-centered communication.
Exactly. Notice how the healthcare professional did more than simply give advice.
Clear. They asked open questions, acknowledged the patient's concerns, provided reassurance, and involved the patient in decisions.
Thoughtful. They also used simple language instead of overwhelming the patient with medical terminology.
Warm. And that is a communication skill that OET medicine candidates should practice regularly.
So now it's your turn.
Clear. Imagine you're the healthcare professional in that consultation.
Calmly, the patient says, "I'm frightened that I'll develop the same kidney problems my mother had."
Take a few seconds and think about how you would respond.
Calmly, remember the 3 steps. Acknowledge the concern, provide reassurance, and offer practical information.
Warm. Here's one possible response.
Warm. I understand why you're worried, especially because of your mother's experience. However, having diabetes does not mean that you will automatically develop the same complications as your mother. By managing your blood glucose, blood pressure, and other risk factors, we can work to reduce your risk.
Excellent. That response sounds professional, empathetic, and reassuring.
And most importantly, it avoids making unrealistic promises.
That's an important point to remember.
Warm. In the next part, we're going to break down some of the medical vocabulary from today's consultation and practice recognizing paraphrases.
So, get ready for a proper OET listening challenge.
Now it's time to focus on some of the important medical vocabulary we've heard throughout today's episode.
And this section is especially useful if you're preparing for OET medicine, because medical words can sound quite difficult at first.
But once you understand the meaning and hear the words used in context, they become much easier to remember.
Exactly. So we're going to take some important terms one by one.
Let's start with one of the most important terms from today, insulin resistance.
Insulin resistance means that the body's cells do not respond effectively to insulin.
In simpler language, the body has insulin, but it doesn't use it as effectively as it should.
That's right.
Now, here's an important listening tip.
What is it?
In an OET listening task, the speaker may never say the exact phrase insulin resistance when the question refers to it.
Really?
Yes, the speaker might say the body becomes less responsive to insulin.
Which means the same thing.
Exactly. That is paraphrasing.
And recognizing paraphrases is a very important listening skill.
So when you practice, don't just memorize individual words.
Learn different ways of expressing the same idea.
Let's try another example. What does hyperglycemia mean?
Hyperglycemia means that the level of glucose in the blood is higher than normal.
And the healthcare professional might simply say, your blood sugar is too high.
Exactly. Medical term, hyperglycemia.
Plain language, high blood sugar.
Both can refer to the same basic idea, depending on the context.
Now let's look at another useful expression. Blood glucose control.
Blood glucose control refers to how well a person is able to keep their blood glucose within the recommended range.
And if someone says her blood glucose is poorly controlled, what does that mean?
It means her blood glucose levels are not being managed effectively.
Very good.
Another important term is HbA1c.
HbA1c is a blood test that provides an indication of average blood glucose levels over the previous 2 to 3 months.
So it gives us information about longer-term glucose control rather than just the blood sugar level at one particular moment.
Exactly.
What about the word adherence?
Adherence refers to how consistently a patient follows the prescribed medication plan.
And that's slightly different from simply saying the patient takes medication.
Yes, adherence focuses on whether the treatment is being followed as recommended.
A patient may take their medication sometimes, but if they regularly miss doses, adherence may be poor.
Exactly.
Now let's talk about complications.
A complication is an additional health problem that develops as a result of a disease or condition.
So, kidney disease, eye problems, and nerve damage can be complications associated with poorly controlled diabetes.
Correct.
Now, another phrase that comes up often in healthcare is risk factor.
A risk factor is something that increases a person's likelihood of developing a particular disease or health problem.
Such as having a family history of type 2 diabetes.
Yes, a family history can be a risk factor.
And physical inactivity can also be a risk factor.
Exactly.
Now, let's pause here for a moment and think about something important.
What?
Some medical terms have several different ways of being expressed in everyday healthcare conversations.
Give us an example.
Risk factor might become something that increases your risk.
Monitor your blood glucose might become keep a regular check on your blood sugar.
Medication adherence might become taking your medicine as prescribed.
Exactly. This is why learners should listen for meaning rather than individual words.
Now, let's make things a little more challenging.
Time for an OET-style listening challenge.
Imagine you hear a healthcare professional say, "We need to keep a close eye on your blood glucose levels over the next few months."
What does keep a close eye on mean?
Think about it for a moment.
It means to monitor something carefully.
Exactly.
Now, this is a good example of informal language being used within a professional conversation.
Now listen to this one. She has been struggling to follow her medication regimen.
What does that mean? Think for a moment.
It means she has difficulty following her prescribed medication plan.
Excellent.
Now, we're going to move into a longer listening exercise.
You hear a short discussion between two healthcare professionals about a patient with type 2 diabetes.
And this time, don't try to remember every single word.
Focus on the main ideas, the speaker's concerns, and the practical recommendations.
Here we go.
I've just reviewed Mr. Patel's latest results. His HbA1c has improved slightly, but it's still above the target range we discussed.
Has he been taking his medication regularly?
He says he has, although he occasionally forgets an evening dose.
That could be something worth exploring. Did he mention any side effects?
No significant side effects. However, he says his work schedule has been unpredictable recently.
That might explain some of the missed doses.
Yes, he also told me that he stopped going for his evening walks because he's been working late.
So there may be more than one barrier affecting his diabetes management.
Exactly. I think we should avoid simply telling him to be more compliant.
Agreed. It would be better to explore what changes are realistic given his current schedule.
I'm also considering whether he needs additional support with meal planning.
That sounds reasonable. Perhaps we could refer him to a dietitian if appropriate.
Yes, and I'd like to reinforce the importance of regular monitoring and follow-up.
Good idea. We should also make sure he understands why the HbA1c result matters.
Now, let's see how well you were listening.
Question 1. What issue was identified with the patient's medication routine?
Take a moment.
The patient occasionally forgets an evening dose.
Encouraging. Question 2. What was one possible reason for the missed doses?
Think about what you heard.
His unpredictable work schedule was one possible reason.
Warm. Question 3. What other lifestyle change had the patient stopped making?
He had stopped going for his evening walks.
Encouraging. Question 4. What did the healthcare professionals agree it should avoid doing?
Think carefully.
They agreed they should avoid simply criticizing the patient or telling him to be more compliant without exploring the reasons behind the problem.
Very good. Now, question 5. What additional support was discussed?
They discussed possible support with meal planning, including a referral to a dietitian if appropriate.
Excellent. Now, notice something interesting.
What?
The conversation never directly said the patient is non-adherent because of his job.
Instead, the speakers discussed his unpredictable schedule and missed doses.
Exactly.
So, again, you had to connect the ideas.
That's the kind of listening skill we want you to develop.
Don't wait for the answer to appear as an exact sentence.
Listen for relationships between ideas,
For example, cause and effect,
problem and solution,
concern and reassurance,
symptom and possible explanation.
and recommendation and expected benefit.
These relationships are often more important than individual words.
Now, let's review some of the key expressions from this section.
Keep a close eye on means monitor carefully.
Follow a medication regimen means follow the prescribed medication plan.
Above the target range means higher than the desired or recommended level.
Explore the barriers means investigate the factors making something difficult.
And realistic changes means changes that are practical and achievable for the patient.
Encouraging, these expressions can be very useful in both listening and speaking tasks.
And now it's time for a speaking challenge.
This time, you're going to become the healthcare professional.
Imagine your patient says, I keep forgetting my evening medication because I usually get home late from work.
Take a few seconds and think about how you would respond.
Try to avoid immediately saying, you must remember to take it.
Instead, acknowledge the difficulty and explore a practical solution.
Here is one possible response.
Warm, I understand that your work schedule makes it difficult to remember your evening dose. Let's think about whether there's a routine or reminder that could make it easier for you. Would you be comfortable discussing a few options?
Encouraging. That sounds supportive and collaborative.
And notice that the healthcare professional does not blame the patient.
Exactly.
They identify the barrier, acknowledge it, and then work towards a solution.
That is the kind of communication we want you to practice.
And remember, the goal is not to sound like a textbook.
The goal is to sound like a healthcare professional having a clear, natural, and respectful conversation with a patient.
Now, we're going to take our medical conversation one step further and focus on complications, monitoring, and how healthcare professionals explain risk without frightening patients.
We've already discussed what type 2 diabetes is, how it can be managed, and how healthcare professionals can communicate with patients in a supportive way.
And now we're going to focus on something that can be challenging for both healthcare professionals and patients: diabetes-related complications and the importance of regular monitoring.
Yes, when patients hear the word complications, they can sometimes become very anxious.
Especially if they already know someone who has experienced problems related to diabetes.
Exactly. So the way we explain risk is extremely important.
Let's start with a simple question. What do we mean when we talk about complications of type 2 diabetes?
We're referring to health problems that can develop when diabetes is not well controlled over a long period of time.
And these complications can affect different organs and systems in the body.
That's right. Diabetes can affect the blood vessels, nerves, kidneys, eyes, heart, and feet.
So, cardiovascular disease is one area we need to think about.
Absolutely. People with diabetes can have an increased risk of cardiovascular problems, particularly when other risk factors are also present.
Such as high blood pressure or high cholesterol.
Exactly. Smoking, physical inactivity, and other factors may also increase cardiovascular risk.
Which is why diabetes management often involves looking at the patient as a whole.
Yes, we don't simply look at the blood glucose level and ignore everything else.
Let's talk about the kidneys.
High blood glucose over time can damage the small blood vessels in the kidneys, which may affect kidney function.
And this is sometimes referred to as diabetic kidney disease.
Correct.
How would you explain that to a patient without using too much technical language?
I might say, over time, high sugar can put strain on the kidneys. That's why we regularly check your kidney function.
That's much easier to understand.
Exactly. We can always use medical terminology when we need to, but when we're talking directly to patients, plain language is often more appropriate.
What about the eyes?
Diabetes can affect the blood vessels in the retina, which is the light-sensitive tissue at the back of the eye.
And that's why regular eye screening is important.
Yes, early detection can help healthcare professionals identify problems before they become more serious.
So this is another example of why monitoring is so important.
Exactly.
And then we have nerve damage.
Yes, high blood glucose can damage nerves, particularly in the feet and legs. Patients may experience numbness, tingling, burning, or reduced sensation.
Which could make foot problems harder to notice.
Correct. That's why foot care is another important part of diabetes management.
Let's imagine a patient says, "My feet feel perfectly fine, so why do I need to have them checked?"
A healthcare professional can explain, sometimes nerve damage can develop without causing obvious symptoms at first. Regular checks help us identify any problems early.
That's a good example of giving a reason for the recommendation.
And giving a reason can make patients more likely to understand and follow the advice.
Instead of simply saying you need a foot examination, you explain why the examination is necessary.
Exactly.
Now, let's talk about monitoring in a little more detail.
Diabetes monitoring may include regular checks of blood glucose control, blood pressure, cholesterol, kidney function, eye health, and foot health.
And some patients may also monitor their blood glucose at home.
Yes, depending on their treatment plan and clinical needs.
I think one thing patients sometimes struggle with is understanding why they need so many appointments and tests when they feel well.
That's a very good point.
How would you explain it?
I might say, I'm pleased that you're feeling well, but some complications can develop without causing symptoms in the early stages. Regular checks allow us to identify potential problems and manage them as early as possible.
That's a very useful response.
Yes, it explains the purpose of monitoring without trying to frighten the patient.
So the message is not something bad is going to happen.
Exactly. The message is we're monitoring you so that we can identify and manage problems early.
That difference is really important.
It is.
Now let's look at another important term. Risk reduction.
Risk reduction means taking steps to lower the likelihood of a negative health outcome.
So when we encourage a patient to stop smoking, control their blood pressure, and manage their blood glucose, we're talking about reducing their overall risk.
Exactly.
Would you tell a patient that these steps will guarantee they won't develop complications?
No, we should never promise something we cannot guarantee.
So what would you say instead?
I might say these measures can help reduce your risk of complications.
That's much more appropriate.
Another useful phrase is this can help protect your long-term health.
Excellent.
That phrase focuses on the benefit rather than the fear.
And that can make communication more positive.
Exactly.
Now, let's imagine a patient asks a difficult question.
Go ahead.
Let's imagine a patient asks, "Doctor, if I control my diabetes perfectly, does that mean I'll never have any complications?"
I would respond carefully.
What would you say?
I would say good diabetes management can significantly reduce the risk of complications, but it cannot remove the risk completely. That's why regular monitoring and follow-up are still important.
That's a very balanced answer.
Yes, It gives reassurance without making a false promise.
And that's another important OET communication skill.
Yes, reassurance should be realistic
Not, don't worry, everything will be fine.
because you don't actually know that everything will be fine.
Instead, you can say, we'll monitor your condition closely, or there are several things we can do to reduce your risk.
Those responses are both reassuring and clinically responsible.
Now, I want to talk about one more issue, patient anxiety.
Good point.
Some patients may hear the word complications and immediately become frightened.
In that situation, the healthcare professional should acknowledge the emotion.
For example, I can see that this information is worrying you.
Then they can provide context. The reason we talk about these things is not to frighten you, but to help us identify risks early and keep you as healthy as possible.
That's a very useful communication pattern.
Acknowledge the emotion, explain the reason, and provide a practical next step.
Exactly. Let's practice some of these expressions.
Expression 1. I can see that this is worrying you.
Expression 2. Let me explain why we recommend this test.
Expression 3. The aim is to identify any problems early.
Expression 4. This can help reduce your risk.
Expression 5. We'll continue to monitor your condition closely.
These are simple, natural expressions that can make a consultation sound much more professional.
Now it's time for another OET listening challenge.
And this one is slightly more difficult.
Imagine you hear a doctor say, although you're currently feeling well, we still recommend regular kidney tests because early kidney damage may not cause noticeable symptoms.
Question 1. Why does the doctor recommend regular kidney tests?
Think carefully.
The reason is that early kidney damage may not cause obvious symptoms.
Good.
Now, question 2. What does the doctor mean by saying you're currently feeling well?
The patient does not currently have obvious symptoms, but that does not necessarily mean there are no health problems developing.
Excellent. Now, for question 3, what is the main purpose of regular monitoring?
Take a moment.
The main purpose is to identify potential problems early and manage them before they become more serious.
Well done.
Now, let's make the exercise more challenging.
How?
We're going to give you 3 statements. You need to decide which one best reflects the doctor's attitude.
Ready?
Statement A, the patient is definitely going to develop complications.
Statement B, complications are possible, but good management can reduce the risks.
Statement C, the patient does not need any monitoring because they feel well.
The correct answer is B.
Exactly. The doctor is neither frightening the patient nor giving false reassurance.
The doctor is presenting a balanced view,
And recognizing a speaker's attitude is an important listening skill.
especially when the speaker does not directly say, I'm trying to reassure the patient.
You have to understand the tone and meaning of what they say.
So, when you practice listening, ask yourself, is the speaker worried, reassuring, concerned, critical, supportive, uncertain?
These clues can help you understand the speaker's attitude.
And that can be very useful when answering OET-style questions.
Now, before we move on, let's review today's most important communication principle.
Don't use fear to motivate your patient.
Use information, empathy, and practical guidance.
Explain the risk.
Explain what the patient can do.
Explain how the healthcare team can support them.
That approach can make a huge difference to the quality of a clinical conversation.
In the next section, we're going to turn our attention to something every OET candidate needs: active speaking practice.
This time, you're not just listening.
You're going to speak, so get ready because it's your turn to be the healthcare professional.
Now we're going to change rules.
That's right. Up to now, you've mainly been listening and learning.
But now we want you to imagine that you are the healthcare professional.
And your job is to respond naturally to a patient who has type 2 diabetes.
Don't worry about producing a perfect answer immediately.
Focus first on communicating clearly, showing empathy, and responding to the patient's concerns.
Remember, in a clinical conversation, your patient should feel that you are listening to them.
And you should avoid giving too much information at once.
So let's begin with our first situation.
Your patient has recently been diagnosed with type 2 diabetes.
The patient looks worried and says, I don't understand why I have diabetes. I've never had it before.
Now, pause the podcast.
Take a few seconds and think about how you would respond.
Remember to acknowledge the patient's concern before giving information.
Here is one possible response.
I understand that this diagnosis may have come as a surprise. Type 2 diabetes can develop gradually, and there are several factors that can contribute to it. I'd be happy to explain what may have contributed in your case and discuss how we can manage it together.
Notice the structure.
First, the healthcare professional acknowledges the patient's feelings.
Then they provide a brief explanation.
And finally, they offer support.
That simple structure can make your response sound much more natural.
Let's try another situation.
The patient says, "I'm really scared that I'll need medication for the rest of my life."
Pause here and prepare your response.
Think about how you can reassure the patient without making promises about the future.
Pause here.
Here is one possible answer.
I understand why you might feel concerned about taking medication long term. Your treatment will depend on how well your diabetes is controlled and how your health changes over time. We'll monitor your progress regularly and review your treatment when necessary.
That is a balanced response. It does not tell the patient you definitely won't need medication forever.
And it also doesn't tell them you definitely will.
Instead, it explains that treatment can be reviewed according to their individual situation.
Now, let's make the situation more challenging.
Your patient says, "I work long hours and I don't think I have time to exercise."
What would you say?
Think about it.
Don't simply say you need to exercise more.
Try to explore the patient's routine first.
One possible response could be,
"I understand that your working hours make it difficult to find time for exercise. Could you tell me what your typical day looks like? We may be able to identify a small amount of physical activity that would fit into your routine."
that's much more patient-centered.
You're not arguing with the patient.
You are trying to understand the barrier.
And then you're looking for a practical solution together.
That is exactly the kind of communication pattern you should practice.
Let's move to another common concern.
Your patient says, "My father had diabetes and lost his eyesight. Is that going to happen to me too?"
This is a sensitive question.
You need to acknowledge the fear first.
Take a moment.
Here is one possible response.
I can understand why your father's experience would make you worried. Having type 2 diabetes does increase the risk of certain complications, but it does not mean that you will automatically develop them. Good blood glucose control, regular monitoring, and appropriate follow-up can help reduce your risk.
Notice how we avoid saying, "Don't worry."
Instead, we explain why the patient can be reassured.
That is much more effective in a clinical setting.
Now let's practice giving advice.
Your patient says, "I drink several cans of sugary drinks every day. I know I should stop, but I really like them."
What could you say?
Think about a response that is realistic rather than judgmental.
Here's one example.
It's good that you've recognized that this is something you may want to change. Rather than stopping everything at once, you could start by reducing the number of sugary drinks you have each day and replacing some of them with water or another lower sugar option.
That's much more achievable than simply saying you must stop them.
Exactly.
Let's focus on another OET skill now, checking understanding.
Imagine you have explained the patient's medication instructions.
What could you ask?
You could say, "Just to make sure I've explained that clearly, could you tell me how you'll be taking this medication?"
That is a very useful phrase.
Another option is, "Could you tell me in your own words what we've agreed?"
Both expressions encourage the patient to explain the information back to you.
Which helps you identify whether they have understood correctly.
Now we're going to practice a longer scenario.
Imagine you're seeing a patient who has just been diagnosed with type 2 diabetes.
The patient is overweight, works at a desk, drinks sugary beverages regularly, and does very little physical activity.
The patient says, "I know I should make changes, but honestly, I don't think I can manage all of this."
Pause the podcast.
Your task is to respond to the patient.
Think about empathy, exploration, and achievable goals.
Think about it.
Here is a model response. I understand that it feels like a lot to take in, especially after receiving a new diagnosis. We don't need to change everything at once. Let's look at your current routine and choose one or two changes that feel realistic for you. We can then build on those gradually.
That's a strong response.
It reduces the patient's sense of being overwhelmed. It also encourages shared decision-making.
Now, let's practice asking open questions.
Imagine the patient says, "I'm too tired to exercise after work."
What open question could you ask?
You might say, what does your daily routine look like from morning to evening? Or, are there any times during the day that you feel more energetic?
Or even, what types of physical activity would you feel comfortable doing?
These questions help you understand the patient before giving advice.
And that is an important lesson for OET speaking.
Don't rush into giving recommendations.
Ask questions first.
Listen to the answers.
Then tailor your advice.
Friend the tone.
Let's do one final role-play challenge.
You're the healthcare professional.
Your patient says, I've heard that people with diabetes can't eat any carbohydrates. Is that true?
Think about how you would correct the misunderstanding. Here is one possible response.
Not necessarily. You usually don't need to avoid all carbohydrates. What matters is the overall quality and balance of your diet, as well as portion sizes and the types of carbohydrates you choose. We can discuss your usual meals and see where small changes could be helpful.
Excellent.
That response corrects the misunderstanding without making the patient feel embarrassed.
And that is another important principle.
Correct the information, but protect the patient's confidence.
Now let's review some phrases from today's speaking practice.
I understand that this may be worrying for you.
I could tell me a little more about your concerns.
Let's look at what would be realistic for you.
Would you be comfortable discussing your daily routine?
We can work through this step by step.
Let's find a plan that suits you.
Just to make sure I've explained that clearly,
Could you tell me what you understand so far?
we can review the situation again at your next appointment.
These expressions are simple, but they can make your communication sound much more natural.
And remember, you do not need to use exactly the same words every time.
The important thing is to communicate the right meaning with empathy, clarity, and professionalism.
Before we move on, we have one final speaking challenge for you.
This time, there's no model answer immediately.
Your patient says, I'm finding it difficult to remember my medication, manage my diet, and exercise. I feel like I'm failing.
Pause the podcast and respond as the healthcare professional.
Try to acknowledge the patient's feelings, reassure them, and offer one practical next step.
Take your time.
And when you're ready, continue listening.
Here is a model response.
I'm sorry you're feeling that way. Managing a long-term condition can be challenging, and it's understandable to feel overwhelmed sometimes. You're not expected to make every change immediately. Let's choose one area to focus on first and work out a practical plan together.
That's a strong response. It changes the conversation from failure to progress. Instead of focusing on what the patient is doing wrong, it focuses on what can be done next.
That is patient-centered communication, and it's also good medical English.
In the final part of today's episode, we're going to review everything we've learned. We'll recap the key medical vocabulary, the important communication strategies, and the listening techniques you can take into your OET preparation.
And now we've reached the final part of today's episode.
We've covered a lot, so this is the perfect time to review the most important points.
And remember, the goal of this podcast is not simply to memorize medical terms.
It's to help you understand medical English when you hear it and use it naturally when you speak.
So let's begin with our medical vocabulary review.
First, insulin resistance.
Insulin resistance means that the body's cells do not respond effectively to insulin.
Second, hyperglycemia.
Hyperglycemia means that the level of glucose in the blood is higher than normal.
Third, HbA1c.
HbA1c is a blood test that gives an indication of average blood glucose levels over approximately the previous 2 to 3 months.
Fourth, medication adherence.
Medication adherence refers to how consistently a patient follows their prescribed medication plan.
Fifth, risk factor.
A risk factor is something that increases a person's likelihood of developing a disease or health problem.
Sixth, complication.
A complication is an additional health problem that can develop as a result of a disease or condition.
And seventh, patient-centered care.
Patient-centered care means considering the individual patient's needs, concerns, preferences, and circumstances when planning and delivering care.
Excellent. Those are 7 important terms from today's episode.
Now, let's review some of the communication strategies we practiced.
First, acknowledge the patient's feelings.
For example, I understand that this diagnosis may be worrying for you.
Second, ask open questions.
For example, Could you tell me more about what concerns you?
Third, avoid unnecessary medical jargon.
Instead of using complicated terminology, explain the idea in plain language whenever appropriate.
Fourth, check understanding.
For example, could you tell me in your own words what we've discussed?
Fifth, involve the patient in decision-making.
Use phrases such as, let's work out a plan that suits you.
And finally, provide realistic reassurance.
Rather than saying everything will be fine, explain what can actually be done to reduce risk and support the patient.
These are simple techniques, but they can make a big difference in a real clinical consultation.
And they can also help you sound more natural during your OET speaking role play.
Now let's test your listening one last time.
This is the final OET style challenge of today's episode.
Listen carefully to this short clinical discussion.
I'm concerned that Miss Wilson's blood glucose control has deteriorated over the last few months.
Has anything changed in her routine?
She recently started working longer hours and said she has stopped exercising regularly. She also admits that she sometimes misses her medication.
Do you think she understands the importance of taking it consistently?
I think she does, but she's finding it difficult to maintain the routine.
In that case, it might be helpful to explore the barriers rather than simply repeating the same advice.
Agreed. I'd also like to review her diet and see whether she would benefit from additional support.
That sounds reasonable. We can discuss a realistic plan with her at the next appointment.
Now, here is your first question.
What has changed in Miss Wilson's routine?
Take a few seconds. She has started working longer hours and stopped exercising regularly.
Good. Question 2. What difficulty is she having with her medication?
Think about it. She sometimes misses doses.
Excellent.
Question 3. What approach does a second healthcare professional recommend? Listen for the main idea. They recommend exploring the barriers that are making it difficult for her to follow the treatment plan.
Well done.
Question 4. What other area of her care do they want to review? Take a moment. They want to review her diet and consider whether she needs additional support. Very good.
Now let's look at the speaker's attitude.
Are the healthcare professionals blaming the patient?
No, their approach is supportive and focused on identifying barriers and finding practical solutions.
Exactly.
And that's an important listening skill. Understanding not just what the speaker says, but why they say it.
Now, let's do one final paraphrase exercise.
Listen to this sentence. Her blood glucose control has deteriorated.
What does deteriorated mean here? Think about it. It means that her blood glucose control has become worse or declined.
Exactly. So remember, deteriorated can be paraphrased as got worse or declined.
Here's another one. She's finding it difficult to maintain the routine.
That could mean she is struggling to keep following her usual treatment or lifestyle plan.
Exactly.
And one more, explore the barriers.
That means identify the reasons or factors that are making the treatment plan difficult to follow.
Great.
Before we finish, let's return to one of the biggest lessons from today's episode.
Good communication is not about speaking with the most complicated vocabulary.
It's about making your message clear.
It's about listening to the patient.
It's about asking the right questions.
It's about showing empathy.
And it's about working with the patient rather than simply giving orders.
That is what patient-centered communication looks like.
And these are exactly the kinds of skills that can help you become a more confident healthcare professional and a stronger OET candidate.
So, if you're preparing for OET medicine, don't just memorize vocabulary lists.
Listen to natural medical conversations.
Pay attention to how ideas are paraphrased.
Practice identifying the speaker's attitude.
Learn how healthcare professionals explain difficult information.
And practice responding to patients in your own words.
That is how you gradually build real communication skills.
And that brings us to the end of today's episode.
We hope you enjoyed learning about type 2 diabetes with us.
More importantly, we hope you learned some useful medical vocabulary and communication strategies that you can actually use.
Especially if you're preparing for OET medicine.
Keep listening, keep practicing, and remember that progress comes from consistent practice.
Don't be afraid of difficult medical English.
Break it down.
Listen to it in context.
Practice it aloud.
And use it in your own sentences.
Thank you so much for spending this time with us.
We'll be back with another medical topic, another useful conversation, and more OET-style practice.
Until then, take care, keep learning, and keep improving your English.
Goodbye, everyone.
And see you in the next episode of the Nano and Honey podcast.